regional and local level, but it depends on every time for every decision from the addictions department. And then there are the public services for pathological addiction. We call them CERT, and they are the main responsible for the prevention program. And we have several of those public services on the whole nation. And now Antonina will explain you how the services are working and which are their action plans. So, grazie.
The SAD is a public service of Italian national health system. Is dedicated to the care, prevention, and rehabilitation of people who have problems with the abuse and addiction of psychoactivity substance or compulsive behavior such as pathological gambling. In the CERT, there are qualified and specialized professionals in addiction, such as doctors, nurses, psychologists, educators, health assistants. The service offers psychological support, pharmacological support, proposes rehabilitation projects, such as making a path in the community. Other service is the drug-related harm reduction. Is a health and social strategy to reduce the negative effect and risks related to drug use. The drug-related harm reduction composes of drop-in, that center from Monday to Friday, and strict control camper. This service offers distribution of sterile materials and collection of used syringes. Information on harm related to drug use and the use of naloxone in cases of overdose. Information on other service in the area. Interviews only at drop-in, showers and toilets and laundry. The drug-related harm reduction training for peer educator, consumers capable of helping other consumers. Also training on the use of naloxone in cases of overdose. Now Stefania explore the current situation in Italy.
Okay. So we moved the focus about the MPS from the current situation in Italy because we have a really problem, especially in Venice. In fact, you can see that we have the most highest percentile of death for overdoses caused by yellow heroin. That it's new drugs for us because it's imported by the Nigerian traffic, and it's only the 2 last years that the yellow heroin became to Italy. And also you can see the media, the newspaper, all the attention is focused on this type of heroin. So from the 2017 there has been an increase in overdose cases due to the use of yellow heroin. And Mestre become, that is the main island of Venice, become the capital of the traffic of these substances. In particular, the yellow heroin is not an NPS, but is similar because it's really economic respect the heroin, and it's very easy to buy in the street because there are many Nigerians that can sell the substances to you. And the most important things of yellow heroin is that it's 25 times more strong than the classic heroin. Okay, so our public service, CERD, for therapeutic communities now start for contrasting the case of overdose, several learning and teaching activities. So they come directly in the therapeutic community to inform their educators and therapists and psychologists on the new drugs. And in particular, it's important for us to have a clear guideline for prevention for this type of overdoses. That means that we know to inform the clients about the risk of the relapse, also when they are out of the therapeutic program. And our reflection and practical work is that we are still working on the specific problem for do prevention in our facilities, because we don't have, because we have to we work with the user with classical drugs. So for us, it's totally new the problem. We have now about 60 clients, and we have just one client that use MPS and buy drugs from internet. So for us, it's total new things. But Daniela now will explain that we do a daily work in our facilities, and as you can.
Okay, we don't have a prevention program, but our prevention tools are a drug and alcohol test that we make every moment if we think there is a strange behavior or strange situation, or we have a report about the other guest to the specific patients. We have individual interview with educator and therapist, space when we talk about our patients about the daily problems, like to stay in a facility, to coexist with the other guests, or to decide to don't give up the program, or craving, and we consider the risk of decided to give up the program. In fact, we have two problems very high, because one is the risk of overdose, because our patients don't use drugs during the therapeutic program, because we are residential community. So we use only the substitute therapy like methadone or Subutex. And another big problem is leave the child, especially for Casa Aurora, one of two facilities of Comunità di Venezia. We are a mother-child therapeutic facility, and we work with patients sent from social service or CERD, and they arrive in community because they have a degree from juvenile court. So their motivation is low, and is a problem if they decide to give up the program and leave the child, because the risk is that the child goes to the forest family, or in extreme cases to go to in adoption. In other tools, you contact the CER doctor. CER is addiction service, and the doctor often adjusts the therapist of the patients, the level of methadone or Subutex. And the other, then we have a harm reduction when one patient is decide to give up the program. We don't give money, notify the relative friends, the social service, in the end the court, and give Narcan, that is a life-saving drug for overdose.
I want just to add something. Thanks for the attention, but not yet. So I just want to say something more, because if my computer start to collaborate. Okay. No? Yes. Because you all spoke about that, so in Italy we also have some area interventions, so like the public services, no, it won't collaborate. Okay, well, okay. The public services work on the school area. That means that go into school and they speak with the children and try to inform them on the risk of drug user and so on. And they also have groups with relatives in the family area. That means they teach the parents how to recognize a drug use, and that's really important. And but the most important area is the social one. We have street units. That means educators and psychologists that goes in the streets, in the park, and look for guys who are using drugs or searching for drugs, and they speak with them and try to convince them not to buy drugs or to get into a rehabilitation program, and that's really work for us in Italy. So that's all.